Let's dive into the discussions shaping the nation.
Thank you, Concordia. And I want to also welcome Cara and Mark to the public gallery today, and we'll be speaking on that issue later on in the day. It's a scandal that you have to be here again, Cara, to protest on this issue. The issue I want to raise with you, Taoiseach, is primary care, or the absence of primary care. It's over 8 years since Launch Care plan was agreed for a public health system by all parties in this House at the time. And it's due to be fully up and running by the end of this year, by the 31st of December. But of course, we're so far away from the full implementation of its recommendations and of what was set out in that plan. And nowhere is this more starkly seen than in the area of primary care. The sparse nature of it right throughout the state, and particularly in County Laois. And despite the best efforts of those GPs and staff working in the sector across the state, we're not within a country mile of having a properly resourced and fully functioning primary care system. The effects of that are many: lack of timely intervention, where minor health issues become chronic cases and finish up in hospitals. We have emergency departments who are clogged up with people who can't afford to go to a GP because they don't have a medical card, or in some cases they cannot even get a GP, even when they have a medical card or even when they're going privately. I have people that come to me on occasions, and even when they're paying privately, they can't access a GP. And treatments that should be available in primary care centres and in local health centres are just simply not there. So it's off to the hospital. That's where people are going. So the basics are that we have to have health centres and GPs to staff them, and the ancillary staff, which we don't have in this country, to manage them, to man them, and to make sure that the service is there. And in County Laois, we're short on both counts of the basics. We have no primary care centre in Portlaoise, a town with a population which is exceeding the city of Kilkenny. It's a population now in the region of 30,000. We've health centres in Mountrath and Borrisnostre, Rathdowney, Greycullen that need either replacement or upgrade. In the case of Portlaoise, the design is done, but it requires capital funding to move it on. It's on a perfect site located. Mountrath, the site that the centre of the stair is too small, it's outdated, it's been talked about, but it needs to be moved on. Rathdowney is the same, totally unsuitable, and that needs to be progressed to put in place a new centre. But we're moving at snail's pace, Taoiseach. Borrisnostre needs replacement, and there's an opportunity there now to locate it within the new courthouse, within the old courthouse that's been refurbished by the County Council. Greycullen, the same. There's talks about making the health centre for the south-east corner of Laois, taking into Swan and Newtown, Crettyard, Killeshan and Arles. But this can't happen because as things stand, they can't even cater for the population of Greycullen. So will you start resourcing primary care in County Laois and other counties?
First of all, I thank the Deputy very much for raising the issue of the crucial importance of primary care provision. Indeed, when I was Minister for Health, we made primary care a cornerstone of the then health strategy at the time in 2001, Quality and Fairness. It took some time, but I think in the modern era we have progressed fairly significantly in terms of the provision of primary care centres. There are now about 179 primary care centres across the country, and 50 of those have been opened since 2020. And overall, the government is delivering record levels of investment in health services. A record 25 billion in 2025, and that represents an increase in health funding since 2019 of over 70%. It also, in parallel with primary care, supports very important initiatives like enhanced community care, and in terms of oral health, palliative care, and obviously cardiovascular and cancer care. And sometimes people say, health absorbs an awful lot of expenditure, and are we pouring all the money into an empty sort of black hole? We're not actually. Outcomes are improving all of the time, and that needs to be acknowledged as well. Life expectancy is now above 82. We're in a small group of 7 EU member states where that is the case. Our mortality rate fell by 11% over the decade, 214 to 222. Mortality rate for all circulatory system diseases fell by 20% in that period, with heart disease and stroke falling by 28% and 37% respectively. And a lot of that was due to the work in primary care in terms of cardiac initiatives in particular. Mortality rate for all cancers dropped by 15%, with cancer of the trachea, bronchus and lung and breast cancer dropping by 21% and 22% respectively. And mortality rate for all respiratory system diseases has fallen by 15%, with pneumonia, with chronic lower respiratory diseases and pneumonia falling by 9% and 41% respectively. Now I say all of that, we are making progress in terms of investment in health and critically in terms of health outcomes. There are other aspects of that, healthy lifestyles and nutrition and so on. But primary care is central to it. And we will, in terms of chronic disease, for example, chronic disease management, primary care is where it's at. And 95% of GPs are now signed up to the chronic disease management programme, and over 645,000 patient reviews by GPs in 2024 alone. And 92% of patients with chronic disease are now fully managed routinely in primary care and not attending hospital for managing their condition. Now, I'd say by what you have said, progress is happening. In your constituency, I think Portlaoise, you said the design stage is complete for the primary care centre, and you said it's an excellent site. So I would anticipate progress in that regard. I will check with the Minister and with the HSE in respect to the capital requirements for that. But I hear you loud and clear, and it is an important centre of population that does require a primary care centre.
Thanks, Taoiseach, for your reply. But also we need GPs. And Mike Colleton of the Irish College of General Practitioners, he said that we clearly have a deficit in our GP numbers, and he listed out a number of counties, including Laois and that. And last time I checked, we were way below what's required. Primary care centres in other countries and health centres include a whole range of services, Taoiseach: physiotherapy, occupational therapy, dental, chiropody, mental health services, etc. But we're miles away from that comprehensive primary care model. We neither have the staff nor the facilities. I agree with you that primary care is the cornerstone. So will your government commit to, and you said 79 have been funded, primary care centres, so will your government commit to the capital funding needed to construct a new primary care centre in Portlaoise? The site is there, the design is there, and new health centres for Mountrat and Rathdowney, and upgrades of Borrisnostry and Greycullen. Will you provide the funding for that? And will you expand and increase the number of GPs per county? There's a commitment in the programme for government in relation to expanding and exploring the number. It says explore the recruitment of HSE employed GPs. We need to go further than explore it. We need to do it. Explore. It says explore the recruitment of HSE employed GPs. We need to start employing a cohort of those also. Thank you.
Yeah, first of all, there are 179 primary care centres now in place, as I said, 179, and 50 of those since 2000 have opened since 2020. And I take your point. I mean, we do still need more GPs. So the outgoing Minister for Health, Stephen Donnelly, had approved with the outgoing Minister for Higher Education, now Taoiseach, additional places in all third-level colleges in respect of medicine, and also in terms of nursing and so on in Northern Ireland. But in terms of the specifics, we have programmes also for rural, to attract people into rural Ireland and to provide greater cover in rural Ireland in terms of rural GP programmes. And we fully accept the challenges that are out there, and I will inquire in respect of Rathdowney and other locations within County Laois, and also critically the status of the Portlaoise project. But we are committed to primary care, and we continue to expand primary care.
Thank you, Taoiseach, and that concludes.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.